I'm Dr. Alvin Thomas. My work and this show is dedicated to educating, validating, elevating, and celebrating the importance of Black fatherhood. This is the Black Fatherhood Podcast. Institutional discrimination is discriminatory treatment of an individual or group of individuals by society or its institutions. This is often seen through unequal consideration or treatment of minority groups, and every society has accompanying institutions and systems like education, justice, finance, legal, policing, housing, health, that structure and guide that society's existence. Each institution in turn is a product of that society's history, and that history lives on through the many policies that guide institutional decisions and interactions with individuals. We've long known that social policies disproportionately affect Black families. Today, we're looking at one social policy and how it impacts Black fathers following the birth of their children. Today, we're talking about birth cost recovery. Birth cost recovery, or BCR, holds unmarried non-custodial fathers liable for Medicaid birth costs in Wisconsin, yet there is little known about the impact of this policy on Black families. Our guest today is Dr. Tiffany Green. She is a nationally recognized economist, population health scientist, and science communicator whose mission is to reduce and eliminate racial or ethnic disparities in reproductive health. She is currently Associate Professor of Population Health Sciences and Obstetrics and Gynecology at the University of Wisconsin-Madison. She's a member of the Wisconsin State Maternal Mortality Review Team and proudly serves as inaugural co-chair of the Black Maternal and Child Health Alliances of Dane County. Her primary research agenda is motivated by a persistent unsolved puzzle: how and why Black people with capacity for pregnancy experience the worst reproductive health access and outcomes of any racial or ethnic group, and what innovative solutions might ameliorate these persistent inequities. Welcome to the show, Dr. Green.
Thank you so much for having me, Dr. Thomas.
Thank you so much. I look forward to what I think and expect is going to be a really rousing but also deeply unsettling conversation around the issues of birth cost recovery, fatherhood, and Black families. But to get us started off, what is birth cost recovery and why was this program started and who does it affect and how? Lots of questions.
Really big questions, but I'll kind of start out with how I got into birth cost recovery. And I think this is important because, as a reproductive health researcher, I was not particularly interested in child support or studying Black fathers. And it's not because I didn't care about Black fathers. It's because when it comes to reproductive health research, data on fathers is often missing. And sometimes, the science follows the data rather than the other way around. And I think that is particularly true when it comes to understanding the experiences of Black fathers. But I came back to UW in 2019 because UW had a cluster hire in reproductive equity. And that's basically when universities say, hey, we don't have expertise in this area. We need people. And I was people. I was the first of the people, rather, that was hired into the School of Medicine to do this work. And I remember getting this email from somebody in the community like, okay, what are you going to do? And I was like, I don't know. I just got here. I'm not one to kind of impose my ideas on what should be happening. But then I met a nurse here, Rachel Azalenko, who told me about birth cost recovery and toxic stress. I'm like, what is birth cost recovery? She's like, oh, it's a program where unwed fathers have to pay back part of Medicaid birthing costs. And I had the same reaction that probably your listeners or anybody else had. They were like, what? I've talked to people literally in other countries and in different states, and they're all like, what? Like, what is the policy where you have to pay back Medicaid birthing costs, in our case, Badger Care? And birth cost recovery, long story short, is a policy that states are able to enact because they interpret federal Medicaid law in such a way that they can go after the father of a child to pay back costs. They cannot go after the birthing person, the mother or other birthing
Hmm.
person. So they will go after the father. Counties have very wide latitude to be able to go after the father for these costs. Proponents of birth cost recovery would say, "Oh well, this is about making sure that people are responsible
Hmm.
for their children." Other people would say, these generally disproportionately impact low income families that cannot afford these costs. They disrupt family relationships. Some people have argued that they affect health outcomes, and I was stunned to learn about this policy and how many people it has affected, but how many people don't know about it, which is really this very interesting tension and contradiction. And that's what started me on the road to trying to understand from as an empiricist. I'm like, okay, these are empirical questions. Some people argue, well, this is driving the high rates of infant mortality in the state.
Hmm.
Now, I think that's a little bit of a stretch for me, but I'm like, it's an empirical question. I am a researcher, and so it's important that I do that. The other piece, though, was that because of structural racism, Black people are more likely to be covered by Medicaid during pregnancy. In fact, more than two-thirds of Black births are covered by Medicaid in this country. And the same is true in Wisconsin. And so, because of that, Black people are, by design, more likely to be potentially affected by birth cost recovery. And yet, I never heard their voices. It's
Hmm.
always people speaking for Black people, Black birthing people, Black fathers, and never the opportunity to speak for themselves. And because of this, I wanted to enter this process in a way that allowed their voices to be centered and their voices to be heard. And I can say that it has been very challenging. It has been an uphill battle to try to, as we know, going through the research process, going to collect data, engaging with communities. But it's something that I am committed to doing in collaboration with community because it is there. These are the people that are affected, and we have to stop doing research in a way that extracts from community and leaves them with nothing to be able to address these issues that are so important.
So we're talking about this whole issue of birth cost recovery from not even a moral high ground, but from this really high up stance of research and whatnot. And there are people out there who probably are wondering, "Oh, I never heard of this birth cost recovery thing." Can you walk us, for example, through what happens immediately following delivery in terms of birth cost recovery?
Sure, and that's what I found has been really interesting. Even people that are likely affected by birth cost recovery don't always know what's going on. It's not a transparent policy. What happens is, let's say that you're pregnant and you are able to be covered by Badger Care. So you're covered by Badger Care. Your delivery is covered by Badger Care, and then you must go through a process. They ask you, well, who's the father of your child? And let's say you tell them who the father is, and then the state, or the county rather, goes through a process of determining paternity, and through that, part of the birth cost recovery judgment is bound up in the determination of paternity and child support. It's two separate things, though, because what's very important here to understand is, one, none of this money goes to the child. It goes to
Mm.
the county. There have been counties that have been very explicit about not wanting any. The best way to say it is weakening of birth cost recovery laws. They say it cuts into our revenues. It's out there. It's very public. I'm happy to include it for you in the show notes. And so this is a very Wisconsin counties collect millions of dollars a year for these costs. Let's say that you are a mother or other birthing parent that does not tell the state about the father of your child, and you've been covered by Badger Care for labor and delivery. Well, they can choose to remove you from Badger Care if you're otherwise eligible. So,
Mm.
if you're pregnant and on Badger Care and you're not otherwise eligible for Medicaid, if you're not pregnant, you get kicked off after so many weeks. But let's say you're eligible for regular Badger Care. If you don't tell the county who your father is, that they can kick you off of Badger Care.
So if the mom does not say does not identify who the father is, she
Yes.
could get kicked off.
Yes.
And if the father is identified, then the father gets garnished.
Yes, you have to pay, or rather, you are liable for those costs. So it is. There are situations where you think it's very obvious that the birthing parent might not want to say, in cases of domestic violence, in cases
Mhm.
of more benign circumstances of not wanting to disrupt their relationship, they might not want to say. And there are avenues for exemptions, but the thing is, the law is not a tool for poor people. It's just not.
Mm.
And so there are very, very few exemptions that are granted every year. So ABC for Health is a public interest law firm that has done a lot of advocacy around birth cost recovery work, and they talk a lot about some of these processes. I would definitely recommend that your listeners, if you want to know more, make sure that you go to ABC for Health site. Eric Gunn is another journalist that has done a lot of good work on birth cost recovery as well.
So I could already hear some people arguing. I mean, great. I mean, I understand the potential negative impact to some families, but shouldn't everybody pay their way through society? Why would society have to cover the cost of somebody else? If you know you can't afford to have a child, then why have a child and burden the state or burden the public with that cost?
That's a really interesting and important question, and it's funny. I was on Twitter this morning. Maybe you saw that, and people were talking
I have
about
not checked your
parenting.
Twitter yet for the morning.
And and to be very honest, Alvin, we loathe poor people. Even people that don't think that they loathe poor people. We enjoy disciplining the poor.
And
Eh,
I want to point out to my Jamaican friends who might be listening and Caribbean friends, she's not saying love. She's saying loathe, as in
Loathe,
as in
loathe,
hate, not loathe.
loathe.
Uh-huh.
We do. In so many ways we tell the poor that they don't deserve to have children.
Mm,
Instead of interrogating a society that is abundantly rich but allows children to starve, we're telling poor people that they should not have children. And even more than that, we will not do what it takes to make sure that that doesn't happen. We also, what the COVID pandemic has shown us is that some people are a paycheck away from going from really comfortable
yeah.
to not comfortable at all, right? And so, as much as we try to think about this as morally neutral, it could be you. A lot of what we do, I think, and this is me as a human being, not necessarily as a researcher, I think, what I observe is this idea in ourselves that we want to make sure it can't be us,
Mm,
that they're doing something bad. Oh, that can't be me. Oh, yes, it can be you. We're one medical emergency, one wrong diagnosis away from poverty. And so what I would say is, rather than talking about everybody paying their fair share, that's why we have public education, because we recognize it's a societal good. We have health care for people that can't afford it. But why not make health care free and accessible, or at least accessible to everybody? So I would start by interrogating systems rather than demonizing poor people who have children. Why do the rest of us have children?
mm.
So
So let's interrogate citizens instead of demonizing people. That sounds like a pretty fair challenge. So I'm going to pull us towards back again towards your research areas. So you're going to be launching this study of birth cost recovery in the state of Wisconsin.
mhm.
Tell us a little bit about what that project will look like and how you're intending to engage Black men, Black fathers in this process.
Sure. So we started out with a community advisory board. We're very fortunate to have folks that have been in the Madison and Milwaukee communities for a long time. I should say that one thing that was helpful in studying this is that Dane County stopped collecting new birth cost
Mm,
recovery funds. And so for in economist speak, I was like, oh, it's a natural experiment. Milwaukee was
Right.
going to stop doing it, but they didn't. And then Dane County actually did. So, of course, the COVID pandemic has made this so-called natural experiment a little bit trickier than one might imagine. But we were able to, through another project funded in part by Wisconsin Department of Children and Families, and that report is up. We were able to look at administrative data to see what happened when birth cost recovery policy changed. I will say, because I'm a researcher, the caveats are that Dane County is very unique among Wisconsin counties on a lot of dimensions. And so we had some challenges finding just the right comparison group, but the
Mm,
preliminary evidence that we have thus far suggests that Dane County cessation of birth cost recovery that was linked to an increase in the chance that fathers owed any type of child support, but it also was linked to an increased chance that fathers were paying money to the mothers or the birthing parents of their children. So that
mhm,
means that we found some preliminary evidence that this is more money going into children's pockets,
mm,
which I think is really important, and particularly
mhm.
among Black fathers.
So this sounds really exciting and kind of is making me think about. So one, we're seeing exactly what we would like to have happen, which is that the money ends up in the pockets of children, in the pockets of the families. So it increases the likelihood of better outcomes for these kids. But as you're thinking about some of these other things that you might be finding or that you might find once all of your data collection is done, how do you see some of the potential outcomes of this study helping families beyond, of course, putting money back in the pockets of these kids and families?
Well, I think I will say that first of all, because I want to be really transparent, we really found this among Black fathers, not among
Mm,
white fathers. So
mm,
there's we're still trying to figure those stories out. But I will say that this was just with administrative data. But I wanted to actually go and talk to people. My original intent, as you know, Alvin, the first time that we put this grant in was to talk to Black dads and moms and birthing parents, but we didn't get that funded. I will forever be salty about that because it was just such a good grant. But then we went back in. I went to the Wisconsin Partnership Program and went through several rounds of funding and of interviews and all that kind of stuff, and they gave us the funding, and we started focusing just on the birthing parents. So I want to say birthing parents, that includes moms and non-cis folks that are having babies. But we realized after a few interviews is that, man, I don't think people fully understand what that is, the birth cost recovery is, first of all. And second of all, you know who is going to understand what birth cost recovery is? The people that are liable.
yeah.
Right?
Yeah.
So, we had always intended to talk to Black fathers eventually,
Hmm.
but then, with qualitative research, which is a very big step away from quantitative research where everything has to go the same way all the time. You have
Hmm.
the ability to flex and have the ability to change midstream if it's in line with your goals. So that's when we started working with our community consultant, Equity by Design. Started talking to you, started talking about to other folks about David Pate, who is a
Hmm.
really renowned researcher about in Black fatherhood, who's back here with us at UW-Madison. Yay. Um,
Across the hall from me.
Sorry, UW Milwaukee, but we got him now. So we started just talking about how we could engage Black fathers, and part of that is one, trying to find a research assistant or somebody that can connect with them and relate with
Mm.
them. Two, thinking about some of my networks. For example, I know one Black male doula, which was very uniquely positioned
Yeah.
to talk about these things. So we are really in the beginning stages of trying to think about and make lists of all the groups of Black fathers. I think another thing that we are doing that is challenging for me is, we're used to being able to do everything through email. I could do, we could conduct these
Ah.
multi-million dollar studies over email, over Slack. And when it comes to things like this, I have, and I'll talk about this tomorrow. I'm doing a talk about this study with my community partner. For the researchers out there, you can't do that. You can't do that. And as much as I have built relationships in these spaces, it requires a level of footwork that we are often not trained to do. So it means me setting up Zoom conversations with clinic directors. It means me dropping off flyers. It means me talking to people over and over and not expecting that those results are going to pay off immediately. So it has definitely been humbling, in a very good way. But Black fathers are clearly, as Alvin knows, I have a Black husband. I have two beautiful Black children, boys, but that doesn't mean that I am an expert in this space.
Yeah.
And it has required a lot of humility, a lot of talking, and a lot of trying to figure this out by the seat of my pants. So Black dads, if you're listening, I'm ready to listen and be humbled, and you tell me about your experiences. And I think, and in all seriousness, also, all jokes aside, I think this is a policy that not in terms of numbers, but just in terms of disproportionately affects
Right.
Black fathers. And I have never heard Black fathers tell their story about how they've been affected by birth cost recovery. I think one exception obviously would be David Pate, Dr.
Right.
Pate and his work. But I've seen like maybe one quantitative paper, and as much as I like numbers, as much as I'm a quant person, Black fathers deserve to tell their stories. Black fathers deserve more than we have provided them as researchers. They deserve not to be a source of extraction for people's careers.
And I think it's exactly that. For a long period of time, they have been the source of extraction. I think the Black communities in general, you think of Henrietta Lacks and beyond, have always been a source of extraction, which is why a lot of communities have difficulty, challenges with trusting researchers, trusting large institutions, research one institutions to come in and do the research. Because it feels like neocolonialism. It feels like a colonization
It is,
of the
though.
human experience.
It ain't no feels like it is.
Hey, I am trying to run a very quiet podcast
You
here.
should have invited somebody else then, because
Apparently, apparently. So I was speaking with some fathers yesterday at one of the Urban League's fatherhood projects that we're working on, and we were talking about mental health. And they do this check-in at the beginning of every session. And as these men were talking about their experiences of the day for that specific day, you could hear some of the way, even when they were saying things like, my day has been good so far, and I thank the Creator for a really positive day so far, and then I have these concerns. And what I kept hearing was, they were able to find these small pockets of positivity in their day, but that there were so many significant other things that they were challenged, that they were hobbled by. And nobody was mentioning birth cost recovery. But you would hear in there the influence of birth cost recovery. So these really exorbitant extractions that were happening on their meager salaries. And for some of them, they were still paying off that birth cost recovery, or still paying off arrears on some other kind of extraction from their salary. And how much that impacts their anxiety, their depression, their frustration, their traumatic symptoms, how it heightens some other things. So I'm thinking just how these things, how this birth cost recovery plays out in the day-to-day life of a Black man, of a Black father.
Yeah, I think that's absolutely true. And you asked me before, and I don't think I answered it well. In terms of this work, what do we hope to do? Well, one is for people to tell their stories, but two, are there key targets that birth cost recovery is impacting? Do I expect it to affect infant mortality? No. And the reason I don't is because infant mortality is a horrendous event, but it's a very rare event. I think it's very hard to sort of draw this line all the way from, okay, you think that the father of your child will have to pay. Maybe you delay prenatal care. I think that's a plausible target. Maybe if it's stress that affects your pregnancy outcomes. Maybe it affects your mental health postpartum. For fathers, I can definitely see it affecting potentially mental health? Again, an empirical question, right? And so I think one of the things that we can do with this work is say to community, well, what is this affecting? Because administrative data is not designed to collect the things that matter. It's designed to collect the things that are relevant to the state, you know.
Hmm.
So if we want to do work that is relevant to communities, we actually have to ask people, well, hey, what do you think matters? And so that's the part of the reason that we have a community advisory board, and part of the reason that I'm going to Black dads and saying, hey, what what do you think? How is this affecting you? And what do I hope will happen? I see myself in the role of as an honest broker. I'm
Hmm.
not going to say birth cost recovery affects anything that we don't find, but I sure am going to talk about what does as well. And I want to give communities the power to go to the people who we elect and who are appointed by our elected officials and say, here's what we have, but you're continuing to implement this policy.
So I was going to ask that very question. I'm going to ask it in a different way. At the top of this episode, we started talking about institutional and structural discrimination, and how the history of organizations is what feeds this discrimination, and that discrimination plays itself out in policies, and those policies play out on families, and those policy implications on families play out on individuals. So as you're going through this study and thinking through this study, how do you see us being able to use this information to change public policy?
So one, as I said, the study that we did before was funded partially by Department of Children and Families. So we said, here's what we have. Here are the facts. Here is what we can see from the data. Here's where we need to go to understand more. Right now, the legislature is busy with many other things that I won't get into at this moment, but also affect Black fathers, right?
Mm-hmm.
But when the legislature comes into session, or even before, community groups, folks can say, look, you are my representative. You're my representative. Here is a policy that affects the folks in my community. What are you going to do about it? I mean, to be fair, and I don't, that's not the right word. I will say during the Walker administration, the last Republican administration, what was interesting is that the governor, that administration implemented a rule that actually made birth cost recovery a little bit less stringent. And so what they said was that if families are intact, if they're living together, you should not be going after them for birth cost recovery.
Mm-hmm.
And as there was a county that was really upset about that. They were like, "Well, people are fraudulent. People are faking. This is affecting our revenues because these are significant revenues that go into the functioning of child support offices." And this
I,
is
I,
not
I
me
like.
being a conspiracy. This is
Right.
literally in the documentation. I mean,
We could go in and find it ourselves if we wanted to.
yeah, I mean, we can also have the whole concept of family policing is a whole
Mhm.
other ball game, but yes.
So as you're pulling this together and centering fathers' voices in this study and this conversation, are there new questions? What new questions have been raised so far from this study? And then how do you see this study fitting into the lives of your boys 30 years from now?
Oh gosh, I can't even look till tomorrow, Alvin. What are you talking
I
about
know
30
you, I know you
years?
don't want to.
They keep me working. They keep their foot on our backs, man. In the best of ways. So just in terms of where I see the study going, part of this is going to have to be conversations with Black men. I
Mhm.
don't I'm not going to, of course there are things that I do as a researcher, decisions that I make, but if I'm serious about centering Black men, if we as a study team are serious about centering Black men, then we have part of that in these interviews has to be what's important to you. What are we not seeing? So I think that will be a big part of it. What I hope will happen is that after this initial pilot study, we will get more funding to be able to really talk to implement even more studies in community with Black men to say how is this affecting us, and what we can do about it. How I hope it will affect my boys 30 years from now, I hope they will see that their mother cared. I hope they will see that their mother lived out her values in centering communities that were affected, in this case, Black men. I hope they will see that their mother loved Black men, and that is reflected in the love that they should have for themselves.
I think that's an excellent place to put a pin in it. Really great ending point. Thank you so much, Tiffany, for joining us for this conversation. I appreciate it.
Thank you for having me.
Policies and the history that informs them are the avenues through which institutional discrimination often functions. But every institution and its accompanying policies were built by a person or persons. This means that these policies and institutions are fallible and should be subject to change, whether cosmetic or through wholesale recall and replacement. Birth cost recovery is a policy that has been written in a way that has allowed it to be interpreted to disproportionately undermine Black and low-income families. How might we better support families? How might we better welcome life into this world? Humanize the family next door. The parent and child taking too long at the checkout counter, the single parent exhaustedly struggling through the last shift of the day. Each person is walking their own path and carrying their own burdens. Humanize each soul you meet today. Cherish their very existence. It is intricately tied to yours in ways that may not always seem so obvious. You've been listening to the Black Fatherhood Podcast. I'm your host, Dr. Alvin Thomas. I'm a clinical psychologist, researcher, and the director of the TriLab at the University of Wisconsin-Madison's School of Human Ecology. Original music for our series was composed and performed by Micaiah De Silva. Our series producer is Joe Ruby. The podcast is supported by the School of Human Ecology at the University of Wisconsin-Madison. And you can follow me on Twitter at Dr_AT758. That's Dr_AT758. And on the web at thomaslab.humanecology.wisc.edu. Make sure to subscribe to the Black Fatherhood Podcast wherever you listen to your podcasts.